A very good evening to everyone. I am Dr. Pushkar and I will be presenting on vitamin E deficiency induced xerosis and corneal epithelial defect in post-ROP laser. I am a vitreoretinal surgeon, so I had experienced this thing in a certain abnormal way. So vitamin E is essential for vision, epithelial growth and immune function. But if it's deficient, it leads to xerophthalmia, keratomalacia and blindness. So preterm infants are especially vulnerable because of the limited hepatic stores at birth of vitamin A, impaired absorption, and inadequate supplementation via parenteral or enteral nutrition. Risk is higher in presence of ROP, poor nutrition, and recurrent infections. Having said that, my case highlights preterm infant with regressed ROP developed xerophthalmia and corneal ulcer due to vitamin A deficiency, and the baby showed significant improvement with vitamin A supplementation, and the case underlines importance of nutritional assessment in preterms with ocular surface diseases. So my case is of 2-month-old female infant with a period of gestation 30 weeks and age at presentation was 46 weeks. The birth weight was 850 grams, current weight was 2 kg, and there was history of ROP zone 2, stage 3, and laser was done. And there was history of 2 units of blood transfusion, CPAP, feeding with express milk without fortification. And the baby presented with frequent crying episodes and was observed repeatedly touching her eyes. So on examination, it revealed that there was a conjunctival xerosis in both the eyes and a corneal ulcer in the right eye. Confirmed in the right eye with the help of fluorescent stain. The ulcer was central sparing visual axis, approximately 2 mm in diameter, superficial, associated with reduced corneal sensations, and smears were negative for bacteria, indicating a sterile melt. So these pictures show a small epithelial defect in the right eye, while conjunctival xerosis is clearly seen on the left eye of the baby. The investigations, we went ahead, since it was a small baby with a corneal ulcer, what it could be, so we went ahead and got a vitamin A tested for the baby, and it came out to be 108.27, while the normal values in 1 to 6 year is 200 to 400. Coming to the management part, the infant was immediately started on 1 lakh international units of vitamin A orally, along with topical antibiotics, steroids and lubricants. There was significant improvement in conjunctival health, and the corneal ulcer showed signs of healing. Post-treatment vitamin A levels were not assessed. So my takeaway points are: maternal vitamin A status, which we hardly see during the pregnancy, significantly influences the newborn's vitamin A reserves, as most transfer occur in the 3rd trimester, which these preterm ROP babies miss. The deficiency per se can lead to xerophthalmia, a spectrum of ocular condition ranging from night blindness to corneal ulceration. Corneal ulcer in vitamin A deficiency is usually bilateral, but in my case, there was xerosis in one eye and ulcer in other. Less than 32 weeks babies have very low vitamin A stores versus the term infants who almost have a 6 months reserves in them. So less than 32 weeks preterm and less than 6 months with vitamin A deficiency. In less than 1.5 kg, we give 3000 international unit per kg per day, as quoted by Tinali et al. In the study. While infants less than 6 months with xerophthalmia, we need to give 50,000 international units. While in my case, we had given approximately 1 lakh international units per day because there was already an ulcer. So risk factors are reliance on unfortified breast milk, prolonged NICU stay, and transfusion. Role of vitamin is important in retinal development and adoption. Xerophthalmia and corneal ulcer shows deficiency despite normal serum levels. High dose vitamin A is safe in acute deficiency, while the recommended dose is 50,000 international units. For continuous 3 days, we give 1 lakh international units. Early vitamin A monitoring in NICU, which is again not done, have prevented severe ocular complications. So conclusion, routine screening with vitamin A in NICU, particularly those with ROP, may be warranted, especially if the baby is coming to you with a watery eye or maybe an ulcer in the eye, then you need to do it. And clinicians should adhere to established guidelines of vitamin A supplementation while remaining alert to deficiency in high-risk infants. With that, thank you so much.
Thank you, gentlemen. My simple one question to you.
Yes, sir.
You have given treatment, you will be giving treatment. What is your first advice to the mother of the baby? Any advice you want to give her?
post-treatment or when I have diagnosed
No,
it?
you have seen the patient. Now you have started treatment for vitamin A deficiency.
Correct.
What advice you want to give that postpartum lady?
Continue with a good breastfeed.
Yes, that's the basic point. Breastfeeding is very important in that case.
Yes.
And good food habit of her also.
Sorry, sir.
For her nourishment also, you have
For,
to take
yeah,
it.
yeah. For her reserves
Any
also we
question?
have to tell her.
So, Dr. Dhir, is it a routine practice to get the vitamin A level in all ROP patients?
So that's what I bring to the point to you, and this article is on going to be get published in IGO. So this is not a routine practice which is being done in NICU, but since we have experienced such kind of cases, now this was the one which I have case reported, probably published in next journal, which of IGO, which is coming. So I'm telling my ICU people to get vitamin A also done. Since they are already taking the blood samples, why not to just go for a vitamin A? And these are like 10 to 20% of the babies who are preterm with them. So there is no harm in getting this thing done also.
Next, be ready, Deepak.
Thank you.
So, whenever you see a ROP patient,
Yes, sir.
whether you go for any test or not, but must advise to the mother.
Yeah. So mother care,
Yes,
the KMC.
that is much more important in that condition.
Yeah.
Okay.
Thank you so much.
No, still not. I have not seen.
It's per se not there, but Tinali et al. I have put a reference also. They have actually done studies in very low birth weight babies where
Sir,
they
Rajao,
have
sir, this is
prophylactically given vitamin A and seen that they
please.
don't have any ocular issues. Thank you.
Thank you.